I'm Penny Spring, and I'm the Director of Public Health for Northumberland, which involves mainly leading on the health and wellbeing of the population and reducing health inequalities. The main issue was when Public Health moved over from the NHS to local authority in 2013, the mechanisms by which we used to pay for these services was sitting within the NHS, and as a local authority we don't have access to those processes. But those processes were very paper-based, and so we wanted to look at something that would be efficient and effective and provide timely payment, but also give us some useful information that we can use in terms of assessing the quality and impact of our services. The portal is an online programme whereby our providers, mainly GPs and pharmacists, are able to import the work that they're doing for us, and then we're able to pay them based on that. So it provides Public Health with some very useful data, and it enables our providers to get paid promptly and accurately.
My name is Pam Foster. I'm the lead public health analyst for the public health team, and I lead on the development of the portal with IT. So kind of been involved with it since its conception, really. Well, I don't think there was essentially a system in place in the NHS. It was all paper-based. I think a lot of the forms used to come in, they were manually input, and then they were paid upon invoice. Going forward into the local authority, that probably wasn't the most efficient way to use staff time, but also to have an audit trail behind that, it was probably more beneficial to have an electronic system. In addition to that, some of the data that we would require for some of the services that we commission, we would then have to buy in from an external source. So to rule that out and to make sure that we had full kind of, not control, but full sight and full use of the information that we needed from our commission services, it was more efficient to build a system, whether that was to go out externally or to explore the possibility of doing this in-house. I think it was probably a real opportunity to produce something that none of us had ever produced before, essentially, and to go through all the different barriers and the challenges that would come out of that. It was really useful to work through all of the different processes, work with all the different providers, work with different teams. So there was obviously our own team, Public Health, and there was IT. We had to involve audit and legal, just to make sure that every aspect of the project and information governance was taken into account before the full solution was developed.
When Pam and Public Health come to us, IT to start off with some requirements of the system, there were various options that they could take. They could have a look at an external system, but we wanted to show kind of what was the art of the possible and what we could actually do. So throughout some initial conversation with the PAM and some initial workshops, we were actually able to produce a specification, and we knew kind of internally with our in-house development and in-house skills that we could actually develop a tailor-made solution for kind of public health, which would help not only PAM and public health but also the GPs and pharmacies, and make a cost saving throughout the whole process.
We always had in mind what benefits that we wanted from that, and that was a portal to be able to receive the information that we needed to be able to pay the providers. What's developed over time has been the ability to change things like patterns in calendars to make it easier for people to submit their information. They might have wanted to see some additional financial information on there, and then over time we've kind of realised that we wanted to be able to produce reports on the actual portal itself. So with the additional funding that we received from the LGE, that was kind of the mechanism to be able to make that happen.
The whole portal has been devised and developed internally, which has been absolutely great for us because it makes it so much easier to maintain it. We don't rely on outside people to do it for us, and when we've needed to make tweaks, we've been able to make the tweaks. So it's an iterative process. So and that has been a huge benefit, not only of having an internal IT and public health team to develop it, but also the collaboration with our partners who are going to use it. So we've ended up with a really effective, impactful product, and it's largely due to the skills and expertise that we have here, but also the collaborative working. We involve the providers right from the start of this project, and as well as looking at how it's been developed to meet their needs. They've also been testing it through the process to see what works, what doesn't work, and what might be tweaked. And then towards the end of the process, once they were happy with the product, we then went and did a lot of training with practice managers and pharmacists so that they were able to use it, and producing guides that would support them. That was something that came out of the development, to actually have a guide so they can actually check down it rather than just remember from the notes of the training. So quite a number of additional support materials have been produced to help them. So some of those practice managers, for example, pharmacists who weren't able to get the training, had some additional support to enable them to use the portal.
I think first, it's imperative as a department that we are improving the health and wellbeing of our local population and reducing health inequalities. What this data that we're receiving from the portal tells us is that we can look at information by different types of geography, by different types of deprivation, so we can see basically where our patients are receiving services and that we're conditioning them in the right way.
Well, it's an initiative obviously from the council to start these schemes as public health, and all of the practices in Northumberland were invited to take part. We had initial training in it based around the NHS health checks and the implants and sexual health that the council's responsible for. And basically we took part. We used to do the health checks manually before. The portal introduced an electronic submission, so effectively make things easier. So I had a bit of training, and that's when we started probably about 3 years ago.
I think it's been really, really important. Users feel empowered. They don't feel that system's being enforced on them. We had some of the initial meetings where we're kind of like to prototype a system and actually show the end users what they will be getting in the future. We also invite them to actually have ideas, in some cases some GPs, pharmacies, and indeed ideas from the public health team were all part of the end product that we see today.
I've been working with the team at the council, and effectively it cuts out all of the admin intervention. So effectively go straight from nurse to claim, where in the past we had quite a lot of time spent by admin making sure that the spreadsheet was right, and then the upload would need to be actually completed in a way which sat well with the spreadsheet that we were given, which wasn't as easy as it actually sounds. But now you put the claim straight in and you upload it to the system, and it works first time. From a nursing perspective, it's going to improve their working life effectively, because they won't be doing administration on something that before took up too much of their time. And in this business, every 10 minutes counts. So you've got a patient booked in every 10 minutes, and the time that is spent in admin can now be used to see patients. So again, it's another hidden benefit of this system, that that'll free up time to do what we're here for.
On average, if a task like doing the claims would take me probably over 3 hours per month, now it's probably taking less than half. So probably in an hour and a half, that same task can be done. So that obviously shows an improvement on the portal. It's easier, it's smoother. It can be improved in some ways still, but it's definitely so much better.
Yeah, well, I think the improvement in the system is such that I think it would encourage other practices to do more work in this area. And when you do more work in this area, that means more patients are being treated. Health checks are an important area for GP practices. So this encouragement will hopefully give us more time to actually do that work. And I think it can be rolled out to other areas, such as sexual health, to ensure that the patient population get the best service we can. Well, because the claims are now so easy, we may well start an initiative to do more health checks, simply because it was putting us off a little bit, to be completely honest, because we had a situation where we'd spend hours uploading the claims, and it really wasn't an efficient use of the nurse's time or the admin time. So now that it's seamless, we'll promote them more, and that should bring in more health checks, and also, you know, it's better for the population really.
I think one of the main outcomes is that public health can now do public health work. They can be proactive instead of reactive. So there's been a lot of things whereby, I suppose previously it was just focused on actually processing the data to actually get the payments out. Now that's almost all automated. Public health can actually be proactive and actually use the data for like intelligence.
Well, it's certainly cut down the time required for them to put in their payments, and they get paid in a timely fashion, which, as we know, is always what people like and appreciate. But the other benefit is that they're able to access their own data quite speedily and promptly. So if a GP practice wanted to know how many smoking quitters they'd had in a particular period of time, and, for example, what socioeconomic group they came from, they would be able to do that. So they have access to better data themselves to help them know how well they're doing. And we have data as well that really benefits us from a public health perspective too. The funding has made a huge difference because it's allowed us to be more innovative. So we've been able to put some systems in place where normally you'd have to do things manually, now it's automated. And it's made a huge difference for our providers, as well as being more accurate for ourselves. Another example of what we've used it for is we can now allow our providers to set their own passwords rather than have to phone through and have them set by us. And for me, in terms of my public health function, it's enabled us to get timely data. We get reports much sooner, and it has really improved the functionality of the programme. So it has made a huge difference. How it has affected me directly is that the process has speeded things up at our end as well in terms of the public health end. Now it's in place, so that frees my staff up to do more work. So we're having a bigger impact on the health and wellbeing population because we've got more capacity to do that, in addition to the commission services that we deliver. One of the main aspects of the sustainability of the portal is the fact that we built it from the ground upwards in the local authority, and we don't therefore need to pay maintenance costs to third-party sources. We don't need to outsource anything, it's all internal. So that has created a huge aspect of sustainability. Another way that we've increased our sustainability with the portal has been that for things like the NHS health checks, for example, many other areas have to buy their data back from another third-party system, whereas we don't, we have it all in-house. So it's made a huge difference to the work that we do and to our costs as well, and particularly to the sustainability of the portal. Very proud of my team and very proud of all those people that have worked towards it, and it's a great example of collaborative, integrated working. So yes, my feeling is one of immense pride.